Hello, guys, and welcome to the Clinician's Guide. Here at the Clinician's Guide, we make sure we simplify your topics. Today, we're going to look at conditions of the gallbladder. I made sure I simplified 4 topics, and we'll be done in just 4 topics, and you'll have the utmost understanding of these topics. So, we're going to look at acute cholecystitis, cholelithiasis, choledocholithiasis, and cholangitis. These are the 4 topics that we're going to summarize today, and we're going to make sure you have understanding on them. So let's start with acute cholecystitis, inflammation of the gallbladder due to impacted gallstones in the cystic duct. Clinical presentation include right upper quadrant, the pain radiates to the back, don't forget that, nausea, vomiting, fatigue, and this also has Murphy's sign. Investigations we can do: amylase lipase test, full blood count, liver function test, as well as abdominal ultrasound. Abdominal ultrasound is actually the investigation of choice here. You can never miss the diagnosis once you do abdominal ultrasound. This is the diagnostic test. Don't forget again, this is the diagnostic test, abdominal ultrasound. When you talk about the complications are chronic cholecystitis and gallbladder carcinoma. Let's go back to the clinical presentations. The clinical presentations are the cardinal things that are going to lead you to want to do an abdominal ultrasound. So don't forget, when you have this clinical presentation, do an abdominal ultrasound, then the liver function test for blood count, and amylase lipase test. These are supportive investigations. The investigation that is diagnostic here is ultrasound. I emphasize on this again, abdominal ultrasound is the investigation of choice. Treatment includes laparoscopic cholecystectomy and open cholecystectomy. Cholelithiasis, that's another topic. Hope you're taking note. Cholelithiasis, formation of stones in the gallbladder as a result of cholesterol supersaturation. So the risk factors are high fatty diet, pregnancy, female gender, fair, and obese. The clinical picture here is colic pain versus at intake of fatty foods. So when somebody takes fatty foods, burgers, deep fried chicken, the pain gets worse, and the pain is colicky. Don't forget that. That's a significant clinical feature, colic pain. Then there's also right upper quadrant pain investigations, abdominal ultrasound again. Whenever somebody, this is just a clinician's tip, whenever you have a patient that has right upper quadrant pain, make sure you start thinking of abdominal ultrasound. So the treatment there is elective cholecystectomy. So choledocholithiasis, that's the obstruction of the common bile duct by gallstones. The clinical picture is proximal inflammation, obstructive jaundice, dilated hepatic duct. Whenever you see something with that has obstructive jaundice as well, think of abdominal ultrasound. Here the treatment and diagnosis is ERCP. So the ERCP is actually a diagnosis and it's also a treatment. Complications include acute pancreatitis and cholangitis. Let's talk about cholangitis now. Cholangitis is just choledocholithiasis that has been infected. The clinical picture is pain in the right upper quadrant, jaundice, fever, and nausea. Complications are pyogenic liver abscess. Diagnosis is right upper quadrant ultrasound, which is an abdominal ultrasound. The treatment is ERCP. Again, ERCP can be used as a diagnostic tool as well as a treatment tool. So all the 4 topics discussed are differentials of each other. Stones can also be broken down by extracorporeal shockwaves as well as intracorporeal shockwaves. Here at the Clinician's Guide, we aim at making a better clinician. Thank you for visiting the Clinician's Guide. Don't forget to like, share, subscribe, and hit the notifications button.